RBT exam practice questions. Registered Behavior Technician Test Prep, 32 actual questions. Question 1. What is one aspect of the learner that is assessed when using clinical judgment? Option A, receptivity. Option B, physical height. Option C, eye color. Option D, shoe size. The correct answer is option A, receptivity. In applied behavior analysis, clinical judgment involves evaluating how open and responsive a learner is to the current teaching environment. Question 2. What is a definition of a progressive approach to applied behavior analysis? Option A, combines the science and art of the field. Option B, a strictly computerized teaching method. Option C, exclusively used for high school students. Option D, a method that ignores historical data. The correct answer is option A, combines the science and art of the field. The progressive approach balances technical scientific protocols with the creative art of teaching based on real-time observation. Question 3. What is one component of rigid applied behavior analysis? Option A, flexible scheduling. Option B, use of humor. Option C, unvarying adherence to protocols. Option D, natural environment teaching. The correct answer is option C, unvarying adherence to protocols. Rigid programs often fail to adapt to the learner because they follow scripts and protocols without making necessary adjustments. Question 4. What is the crux of the progressive approach to applied behavior analysis? Option A, clinical judgment. Option B, high volume of paperwork. Option C, strict discipline. Option D, financial management. The correct answer is option A, clinical judgment. Clinical judgment is the essential skill required to make in-the-moment decisions that benefit the learner within a progressive framework. Question 5. The three branches of the science of behavior analysis are: Option A, psychology and sociology and biology. Option B, experimental analysis of behavior and behaviorism and applied behavior analysis. Option C, chemistry and physics and mathematics. Option D, history and language and arts. The correct answer is option B, experimental analysis of behavior and behaviorism and applied behavior analysis. These three branches represent the experimental study of behavior and the philosophical foundation and the practical application of the science. Question 6. Which of the following is a component of good teaching? Option A, repetitive lectures. Option B, strict silence. Option C, fun. Option D, loud volume. The correct answer is option C, fun. Effective instruction and applied behavior analysis emphasizes keeping the learner engaged and motivated through enjoyment and success. Question 7. Who is commonly attributed for discovering the law of effect? Option A, Piaget. Option B, Thorndike. Option C, Skinner. Option D, Pavlov. The correct answer is option B, Thorndike. Thorndike formulated the law of effect, which states that behaviors followed by pleasant consequences are more likely to be repeated. Question 8. Who is commonly considered the father of behaviorism? Option A, Freud. Option B, Maslow. Option C, Watson. Option D, Rogers. The correct answer is option C, Watson. John Watson is known for his influential work in establishing behaviorism as a distinct psychological school of thought. Question 9. Which of the following is a dimension of applied behavior analysis as outlined by Baer and Wolf and Risley in 1968? Option A, subjectivity. Option B, intelligence. Option C, generality. Option D, reliability. The correct answer is option C, generality. Generality refers to a behavior change lasting over time and appearing in different environments or among different people. Question 10. What percentage of participants reached recovery in the Lovis 1987 study? Option A, 10%. Option B, 90%. Option C, 47%. Option D, 25%. The correct answer is option C, 47%. The landmark Lovis study reported that 47% of the children in the intensive treatment group achieved normal educational and intellectual functioning. Question 11. What was one of the primary lessons learned from the Lovis study in 1973? Option A, the need for better technology. Option B, the need for parents to be trained. Option C, the need for shorter sessions. Option D, the need for more exercise. The correct answer is option B, The need for parents to be trained. Research showed that gains made by children often regressed if their parents were not trained to maintain the interventions at home. Question 12. In the Lovis 1987 study, what was the criteria for the best outcome? Option A, weight and height and age. Option B, intelligence quotient and school placement and diagnosis. Option C, popularity and social media presence. Option D, athletic ability and music skills. The correct answer is option B, intelligence quotient and school placement and diagnosis. A positive outcome was measured by significant improvements in intelligence quotient scores and successful placement in standard classrooms. Question 13. What was one of the rights outlined by Van Houten and others in 1988? Option A, the right to free toys. Option B, learners' welfare. Option C, the right to play video games. Option D, the right to a personal driver. The correct answer is option B, learners' welfare. This landmark paper established that individuals receiving behavioral treatment have a fundamental right to a safe and effective environment. Question 14. Teaching children to label state capitals may be a violation of which of the rights outlined by Van Houten? Option A, learning functional skills. Option B, the right to privacy. Option C, the right to a physical exam. Option D, the right to a clean room. The correct answer is option A, learning functional skills. Effective treatment must focus on skills that are actually useful and relevant to the learner's daily life and independence. Question 15. What are the other two levels created by the Behavior Analyst Certification Board besides the technician level? Option A, doctor and nurse. Option B, teacher and principal. Option C, board certified behavior analyst and board certified assistant behavior analyst. Option D, manager and owner. The correct answer is option C, board certified behavior analyst and board certified assistant behavior analyst. The board offers certification at different levels of expertise, including the behavior analyst and the assistant behavior analyst roles. Question 16. Which of the following is one of the requirements to obtain the registered behavior technician credentials? Option A, a master's degree. Option B, 10 years of experience. Option C, completing 40 hours of training. Option D, passing a driving test. The correct answer is option C, completing 40 hours of training. Individuals must undergo specific training to ensure they understand the basics of behavior analysis before working with clients. Question 17. What is one problem with a sibling of a registered behavior technician being that technician's supervisor? Option A, shared clothing. Option B, potential for the development of a dual relationship. Option C, differences in physical height. Option D, too many family dinners. The correct answer is option B, potential for the development of a dual relationship. Dual relationships can impair professional judgment and create conflicts of interest between personal and professional roles. Question 18. How many face-to-face meetings must occur per month between the registered behavior technician and the supervisor? Option A, at least 2 each month. Option B, 1 every year. Option C, 10 every week. Option D, none are required. The correct answer is option A, at least 2 each month. Regular meetings are required to ensure the technician is receiving proper guidance and to maintain the quality of care for the client. Question 19. What percentage of your total hours of a registered behavior technician must be spent in supervision? Option A, 1%. Option B, 50%. Option C, 5%. Option D, 10%. The correct answer is option C, 5%. Technicians must be supervised for at least 5% of the hours they spend providing behavior analytic services each month. Question 20. What is one of your responsibilities as a registered behavior technician? Option A, writing insurance contracts. Option B, direct instruction. Option C, performing surgery. Option D, managing the payroll. The correct answer is option B, direct instruction. The primary role of the technician is to provide the actual teaching and intervention directly to the learner. Question 21. According to the Autism Partnership Foundation, what are the registered behavior technician standards? Option A, impossible. Option B, advanced. Option C, minimal. Option D, excellent. The correct answer is option C, minimal. The Foundation argues that the current board standards represent a baseline level of competency rather than expert mastery. Question 22. Critical thinking is important to intervention for individuals diagnosed with autism spectrum disorder to ensure that: Option A, the office stays clean. Option B, best procedures are being implemented. Option C, the parents are happy. Option D, the budget is balanced. The correct answer is option B, best procedures are being implemented. Therapists must constantly evaluate whether the methods they are using are truly the most effective and ethical for the individual. Question 23. When receiving feedback, which of the following should be avoided? Option A, listening carefully. Option B, asking questions. Option C, taking feedback personally. Option D, taking notes. The correct answer is option C, taking feedback personally. Feedback is a tool for professional growth and should be viewed as an opportunity to improve skills rather than a personal attack. Question 24. When receiving feedback, which of the following should be done? Option A, arguing with the supervisor. Option B, following through on making changes. Option C, quitting the job. Option D, changing the data. The correct answer is option B, following through on making changes. The value of supervision lies in the technician actually implementing the improvements suggested by the supervisor. Question 25. Which is the best resource for keeping updated on the field of applied behavior analysis? Option A, social media rumors. Option B, personal blogs. Option C, journal articles. Option D, local newspapers. The correct answer is option C, journal articles. Peer-reviewed journals provide the most accurate and scientifically validated information regarding new research and effective practices. Question 26. Which is an example of a soft skill in the workplace? Option A, compassion. Option B, coding in a computer language. Option C, operating a forklift. Option D, calculating square roots. The correct answer is option A, compassion. Soft skills refer to interpersonal qualities like empathy and compassion, which are essential for working with families and learners. Question 27. A group of responses with the same function best describes a: Option A, stimulus class. Option B, reinforcement schedule. Option C, response class. Option D, punishment procedure. The correct answer is option C, response class. A response class consists of different behaviors that all produce the same effect or outcome in the environment. Question 28. Environmental conditions or stimulus changes that exist or occur prior to the behavior of interest is the definition of which term? Option A, consequence. Option B, reinforcement. Option C, antecedent. Option D, generalization. The correct answer is option C, antecedent. Antecedents are the triggers or environmental events that happen immediately before a behavior occurs. Question 29. A stimulus change that follows a behavior of interest is the definition of which term? Option A, consequence. Option B, antecedent. Option C, baseline. Option D, variable. The correct answer is option A, consequence. Consequences are the events that follow a behavior and determine whether that behavior is more or less likely to happen again. Question 30. The duration and rate and frequency of behavior absent of any restrictions is the definition of which term? Option A, discrete trial. Option B, restricted response. Option C, free operant. Option D, fixed interval. The correct answer is option C, free operant. Free operant behavior allows the learner to respond at any time without a teacher having to start each trial. Question 31. The rate and duration and latency of the behavior of interest prior to manipulation of the environment best describes which term? Option A, intervention. Option B, maintenance. Option C, baseline. Option D, generalization. The correct answer is option C, baseline. Baseline data is collected before any teaching begins to understand the current level of the behavior. Question 32. Uncontrolled variables known or suspected to exert an influence on the dependent variable are called? Option A, independent variables. Option B, confounding variables. Option C, target behaviors. Option D, reliable variables. The correct answer is option B, confounding variables. Confounding variables can confuse the results of an experiment by making it unclear which variable actually caused the change in behavior.